Hello everyone. Good morning. Just Dr. Akshita here, and today I'm going to discuss about a new topic that is a Porphyria Cutanea Tarda. Okay, that is called PCT. It is a kind of a blood disorder that affects your skin, and a hormone is a chemical messenger that travels from one cell to another. Okay, this is presented by me. Now, the introduction part. You see, the Porphyria cutanea data is a type of porphyria or a blood disorders that affects your skin, and it is one of the most common types of porphyria that is known as a vampire disease. You see, the vampire disease. Okay, let me take a pencil. Okay, so that often present with the skin manifestations later in life. Now, the disorder why the later in life? Because of the consumption of the excess alcohol or the smoking habits. Now the disorder results from low level of the enzyme that is responsible for the fifth step in the heme production. Okay, here you see the condition of the hens. Now, what are the symptoms? So, for the PCT, the most of the symptoms of the Porphyria cutanea data that appear on the skin, that common symptoms includes a blister on the skin that's exposed to the sun, that includes your hands, face, and arms. Second is a photosensitivity, which means your skin is very sensitive to the sun. Third, that is a thin or fragile skin. Fourth, increased hair growth, usually on the face area. Crusting and the scarring of the skin. Crusting that means abrupt skin or a surface which is not smooth. And a scarring of the skin, which means discoloration of the skin. Now, sixth symptom is a redness, swelling, inflammation in itching of the skin. Seventh is a sores developing after the minor injuries to the skin. What is a sore means? That is a broken surface of the skin, okay? And hyperpigmentation, which means the patches of the skin become very darker in color. Urine, that is a darker than normal or the reddish brown. Or liver damage, okay? Cirrhosis. Now, after the blister form on your skin, the skin may peel. It's also common for scarring to appear once the blister heals. And hyperpigmentation patches usually appear on the all the surfaces like the face, hands, and the neck. So here you see the blisters on the hands. All right. Okay. So next is what are the causes of the PCT? So Porphyria, Cutanea, Tarda, it may be caused by various things. All right, the causes are usually categorized as either genetic or acquired. So there are two regions for the PCT. First is the genetic and second is the acquired. In genetic causes, it includes the family history of PCT, inherited deficiency of the liver enzyme, and the porphyrinogen decarboxylase. This is the enzyme's name. Now, the family history of the liver disease, liver cancer or cirrhosis, and the more liver iron than the normal. Okay, if your iron concentration is more than normal, then it may occur. Now, the acquired causes includes the alcohol consumption, using the estrogen therapy, using the oral contraceptives, exposure to the certain environmental factors such as the chemicals or orange agent, citrus, and the making too much iron and okay, taking too much iron, smoking habits, having the hepatitis C, having HIV, AIDS, human immunodeficiency virus. In some cases, it's not possible to determine the causes of the porphyria cutanea tana. Okay, so you see the genetic causes and the acquired causes. And for that, like we prescribe the serum iron test or we call the TIBC, total iron binding capacity tested, right? So you have to remember that what is the normal value of the iron. So in male, that is a 50 to 150 or 70, okay, and in female Its range is like a 35 to 145. Okay, and it is measured like in a micrograms per deciliter. Okay, uh, micrograms per deciliter. Okay, it is measured. TIBC and iron both are measured in the micrograms per deciliter, and the normal range for the iron, that is a in male 50 to 150 or 70 to 170, and in female 35 to 145, or in some some publications it is mentioned like the 70 to in 70 to 175 micrograms per deciliter, right? All right, next, yeah, iron is represented as a Fe. And what is the atomic number of the iron? Mm, I hope you read the periodic table in your high school, right? All right, so iron atomic number is a 26. Okay. Next, what are the risk factors for the PCT? So you are at high risk of the PCT if you smoke or use the excess alcohol. Okay, excess alcohol and the smoke can lead to the PCT condition, and you are also more likely to get this condition if you have a hepatitis C, liver disorder, or a HIV. Being exposed to certain chemicals like such as orange or citrus things, if you are applying on your skin, it may lead to the PCT porphyria. Now, what is the incidence? It can offer both men and women, and it usually appears after the age of the 13 adults, not in the teenagers. Okay, in adults. So here you see the male hands or the female hands. So blisters or sores, you can see the discoloration of the skin. Now let's understand the diagnosis. What we do, first we take the TIBC, and then second we take the skin biopsy examination. Okay, this is a dermoscope, a new method to check your skin, digital dermoscoper, and this is also a new tool for the skin biopsy. And so, a physical examination or record a past medical history is needed or required, and we use the test to diagnose the Porphyria, Cutanea, Tarda, that is a blood test, urine test, stool test, and the skin biopsy as well. Okay, so skin biopsy is a kind of a veiny puncture on your skin. Okay, and we will check your levels of the porphyrin and the liver enzymes as well. And genetic testing may be recommended for the people with a family history. So, all right, next, what is a skin biopsy? Skin biopsy is a procedure in which a small piece of skin is removed from your body so that it can be examined under a microscope, and the doctor will usually numb the area around the biopsy site with a local anesthetic before performing the procedure. Okay. Now the skin analysis machine you see here is a very modular skin analysis machine. This is machine for the pigmentation analysis, for your wrinkles, or for your moisture analysis. Now this is for the acne analysis, or both pigmentation, wrinkles, and like it is moisture is present or not in your skin. It can measure all other conditions of the skin. Now let's understand the treatment of the PCT. Okay, Porphyria, Cutanea, Tarda. So common treatment options include the phlebotomy, which is removal of the blood to reduce your iron level. Okay, phlebotomy is a very ancient method. I would say like okay, so phlebotomy, which is we call the veiny puncture as well, in which like the tourniquet will be applied on your skin and the blood will be taken from your from your skin. Okay, so needle is inserted into your vein and the blood is collected in a airtight vial or a syringe, and the preparation may be vary depending on the specific test. So this is something the phlebotomy, and second is the chloroquine. Okay, and aniline, hydroxychloroquine, which we call the plaquenil, and the pen medications, iron chelation therapy, and to remove the extra iron from your body, iron chelation therapy, and treating the disease that cause a porphyria, such as HCV, liver infection, or HIV or AIDS. Phlebotomy is one of the most common treatments for the PCT, the surgical opening and puncture of the vein in order to withdraw the blood, which we call the veiny puncture. Okay, anti-malaria tablets are also frequently used. Now here is a tablet, chloroquine phosphate 500 mg, Larigo DS. Okay, this is an anti-malaria drugs for this condition. And next is a hydroxychloroquine that reduces the inflammation, pain, stiffness of the joints, stiffness of joints, that means arthritis. Okay, and can improve or clean up some rashes. So we need to give the low doses of the hydroxychloroquine, or in in market it comes in the Claquenil is recommended for the nerve damage and muscle weakness that can take months to get better, 6 to 12 months, right? All right, so we give for the 6 to 12 months hydroxychloroquine, and this one, the chloroquine phosphate. Now, don't prescribe for the heart patients. You don't need to prescribe this drug for the heart patients. Okay, heart disease such as heart failure or the cardiac arrest, you don't need to give that drug. A slow heart rhythm, or a person who has a low potassium or magnesium blood levels that are not being treated with this drug, and not recommended for the use in the treating the COVID-19 patients as well. Okay, the illness that is caused by the coronavirus SARS-CoV-2. Okay, this is also not recommended for those patients. Now, how to give the iron chelators? Iron chelator. So iron chelator has a two methods, subcutaneously or orally. So with subcutaneously, we give the difoxamine DFO, Dasferil, okay, DFO 500 mg per vial, or subcutaneously, we give the curcumin, which we call the tamarind. Yeah, a naturally occurring yellow pigment found in the turmeric that has iron chelating properties, and it can prevent your tumor growth, angiogenesis, epithelial mesenchymal transition, invasion, and a metastasis. Okay, so here you see the curcumin, vitamin C3 complex, or a DFO, that is a Jardinum X-ray used to treat the chronic iron overload in the adult patients. Okay, so sorry, I forgot to tell you one thing, that we have discussed the iron here, not TIBC range. Okay, so TIBC range is different. TIBC normal range is for a male. Okay, for male that is a 171 to 505. Okay, and for female it is 149 to 492 milligram micro per deciliter. Okay, so this is a TIBC normal range, or this is a iron normal range. And let me tell you one thing more about the iron saturation. Okay, so iron saturation in males, it is about like 20 to 50%. Okay, or in a female it's a 15 to 45%. Okay, so we have discussed. Sorry, I don't know today why I'm making so many mistakes. So here is again, it's not a subcutaneously, it's a orally. Okay, so iron chelators, curcumin, and deferoxiox is given by orally, and the deferral DFO is given by as subcutaneously. And yeah, I forgot to tell one thing more, the meaning of the angiogenesis and the EMT, invasion and the metastasis. The angiogenesis is a kind of the development of the new blood cells. Okay, and EMT, epithelial mesenchymal transition, that means the loss of the polarity, or like we can say the loss of the phenotype stem cells. Okay, phenotype. And invasion means spreading of the cancer cell surrounding the tissues into surrounding the tissues, and the metastasis means the spreading of the cancer cells from one tissue to the one organ to the another organ, or we can say the one tissue to the another tissue. Okay, all right, from one organ to the another organ. Now let's talk about the prevention. Common lifestyle changes include for the prevention to treat the Porphyria, Cutanea, Tarda. That includes you have to avoid the alcohol, liquor. Okay, not you should not consume excess alcohol, and not smoking. You have to avoid the smoking, sunlight as well. Use the sunscreen 30 plus or the 50 plus. Okay, avoid the injuries to the skin. You have to be careful when you are driving and when you are working something and not taking the estrogens. You may have to wear the sunscreen, long sleeves, and had to avoid the suns or uh, and you have to wear sunglasses. Okay, I'm making pet. Okay, such kind of pets or uh, sunglasses. So let's do the summarize of this topic. The Porphyria cutaneous tarda usually affects adults. Okay, about 30 who are older than 30. It's blood disorder that mostly affect your skin, and your skin may be more sensitive to the sun, so you may need to take extra precautions to avoid the sun. And blisters you see that are the more common from these conditions. You will see such kind of the blisters, okay, and the discoloration of your skin. So thank you for watching this video. I hope you like it. If you like it, please do share, subscribe to my channel. And if you have any queries, you can send me email on my email ID, that is drakshitashama1088@gmail.com. Please check out my website as well. There you will see some skin related articles. Okay, and thank you so much for watching.